Alicia with Denver Health Medical Plan, and we're here with our incredible care management team. And we want to introduce you to each one of them.
Hi, I'm Aisha. I'm a nurse case manager with the Denver Health Medical Plan, and I've been here for a little over 2 years.
My name is Judy. I've been with Denver Health Medical Plan for a little over 2 years. I work with the care management department as a health plan care coordinator.
Hi, I'm Dawn. I am the Director of Care Management, and I've been with DHMP for a little over 2.5 years.
I'm Christine. I'm a Health Plan Care Coordinator with Denver Health Medical Plan. I'm on the care management side. I've been with Denver Health Medical Plan for over 3 years.
Hi, I'm Dorothy. I'm a nurse care manager with Denver Health Medical Plan and been here going on my 3rd year.
Hi, my name is Marissa. I'm the operations manager for care management, and I've been with DHMP for over a year.
Oh, thanks everyone. So what is your favorite thing about your role?
I get to serve amazing members and contribute to the health and well-being of Coloradans.
Awesome.
Assisting our members in a time of need when they're most vulnerable.
I get to help members set up their appointments and schedule their transportation.
I get to serve an extraordinary team. The care management team has 26 highly experienced, incredible, dedicated employees. The team includes registered nurses, licensed nurses, master level social workers, registered dietitian, behavioral health, and our health plan care coordinators. The level of professionalism and member advocacy on this team is remarkable.
One of my favorite things is honestly listening to my members' stories and see where they are, and many times being able to spend those extra minutes just kind of meeting them and being that support over the phone, while in addition serving them as well in their health needs in the Colorado area.
I have the opportunity to use my skills as a nurse to assist members in managing their health and navigating the healthcare system.
So great. That's really awesome. So I have a question, and anybody could really answer this. So when you speak to a member, is it because they've called in to talk to you, or do you do the outreach mostly to our members?
It all depends. We get referrals from all lines of business, whether it's commercial, Medicare, Medicaid, DHMP employee. We help them out, whatever it is that they need. We call them, or they can call them. They're
okay.
available.
And how many how many phone calls do you typically each take in a day? Like how many patients, or I guess members, do you help out in a day?
Each of us has caseloads. We all have 2 CMs that we help out. So like each CM has 250 caseloads. So each HBC, which helps plan care coordinators combined, have 500 members to outreach to. I don't know if that's answering your question.
Yeah, I think so. That was great. So each one of you kind of take about 200 each in a caseload. Wow, that's kind of a lot. Interesting. Okay.
So, sorry.
Oh no, go ahead.
So on our side with transition of care, we usually are the ones that initiate the conversation because our goal is to catch a member as they're discharging from the hospital and doing that transition for the month after. So usually it starts with us, but we do get some other stuff that comes in.
So are you only handling people then, Dorothy, with who have been in a hospital stay?
Mm-hmm.
Okay.
Yeah. So typically sometimes we do with our members that have been at Denver Health, but a majority of them have been at other hospitals.
Okay. Awesome. That's great.
So I primarily work with members who have both Medicaid and Medicare, and it usually starts with an initial outreach, and then from there, the members can reach out to me, of course, if there's something that they need, but I do follow up with them regularly as well to see if they have any needs that I can assist with.
What makes care management at Denver Health Medical Plan special to you?
Care management, our goal is to empower our members to access the best quality care. We understand that this can be confusing and overwhelming at times, and that we understand the members could use a little extra help. We encourage our members to be involved in their own care through all of our programs, help guide them through the healthcare system. I think one of the most special things is the connections that form between the members and the care management team. The teams work so hard on building rapport and trust with our members so that they can work closely together to manage care according to the members' needs and the members' comfort level. And I think that, to me, these connections are the most special thing about care management.
I can take that time and to listen to their stories and see where they are. It's part of that rapport building. It's part of that trust building. I'm asking some extremely personal questions at times when we do their health assessment. You know, we're getting very personal information from them. They're not able to see our faces. They don't know who we are. And they are to simply trust a voice over the phone. And I think being able to take that time to build that rapport, to even just hear about, you know, their interaction with their neighbor or their interaction with their cats that day or with their family that day or that month, and us constantly checking in on them, it helps them feel like they have someone that actually cares for them, right? So it might be a little weird to call it care management, but it is a lot of care that goes into it, so that we can then empower them and so that they feel that they can reach out to somebody and say, hey, I'm having this issue, or I need this, I have this need, I have this thing going on. And if we're not able to find the answer, we pull together as a team to find that answer. Not any single one of us knows everything. There's so many new resources out there in the community and things like that, and within Denver Health, that we just are able to pull together as a team and find that information for our members so that they are empowered.
Marissa, would you be able to tell us a little bit about why care management would do health assessments?
Yeah, so I think that for our care managers, we need to know what's going on with the member as far as their health goes, but we also know that their health goes beyond just what is discussed in the doctor's office. It's the resources that they have at hand, it's the support systems that they have, it's their living conditions. And so when we are doing these assessments, we really want to know the full picture of what's going on with these members so we can provide them full person support, get them the resources that they need, and identify barriers to their care.
How can a DHMP member utilize the care management department?
There's different divisions within the department, but within the DSNP department, members who are dual eligible, it starts with any member that enrolls that's dual eligible. They get a call from one of the health plan care coordinators to do a health risk assessment. They're sent a welcome letter that explains kind of what we do, and then from there, they're just able to, you know, build relationships with either the health plan care coordinator or the case managers, and, you know, working towards goals, healthcare goals that they would like to work on. So members are able to utilize us in that way to help them, you know, manage their health care.
Anyone who feels like they need additional support managing their health can utilize our services. We have programs that support members with specific health conditions, such as diabetes and hypertension. We help people who are transitioning out of the hospital, but we also provide services for members who maybe don't want to dedicate their time to a full program, but want some support, just getting to the doctor, connecting to a resource, or navigating their care.
Okay, so one thing I love about Denver Health Medical Plan, it's not just a job you're going to go to and just go back home. It's a job you go to and you love. Like, to me, it's a job that I love and it's rewarding because I'm giving back to the community. And I make sure that, you know, my members are walking away with a smile and they get the care that they need.
I really love the appreciation that our members provide to us, and we are able to give or provide them care management primarily to the underserved and homeless in the area. So they often feel like they're alone and struggle to get on their feet and kind of don't know where to go. And a lot of times we get to be that resource for them to get them connected again.
Great collaboration. When we need assistance from others on the team, we're always there to support each other. And I think we all recognize that the member is the number one priority, and we're all there to do everything that we can to help our members. So I really appreciate the team I'm on.
Awesome. Judy, you were going to say something.
So living in Colorado, and more specifically in the Lowry, Denver metro area, I enjoy that we are actually helping out, realistically, my neighbors. I get to help out my neighbors. I like to volunteer in my community as it is, and working for a place that I can also help out my community is really rewarding.
It's so nice to see a team working so well together and enjoying their time in their role and in their position, and also working so hard for our members. And so on behalf of the engagement committee, I do want to say thank you so much for everything that all of you do for our members. It is not going without notice or without appreciation, and all of you do amazing work. So thank you so much for that.